Thank you for hosting today. And shall I just to start the presentation? Shall I just? This is my. I should be able to now take it forward.
You are now the presenter. Take it away, Raj.
Okay. Thank you so much. Good afternoon, everyone. Presume you guys are all around Asia Pacific, Southeast Asia, I guess. I'm delighted to be joining you today and talking to such an esteemed group of health professionals across Southeast Asia. So as for the introduction, my background has been in all different areas of technology enablement and as well as startups. I recently joined CC&C Solutions because I'm really intrigued by the role of emerging technology and how it could transform organizations as well as industries, and the focus around enterprise architecture as a focal point of starting the transformation. I actually started a research and consulting advisory firm around big data about a year and a half called Big Insights. And so I've been looking at the evolution of big data and how it's changing industries and the new technology paradigms for the last year and a half. So I'd just like to touch on that today and the application in healthcare. So if I could, let me just continue. Next slide. So a little bit about CC&C Solutions. As some of you may or may not be aware, we're a consulting company established just over more than 10 years ago, and our focus is all around enterprise architecture and solution architecture and methodologies and techniques for devising enterprise and solution architectures in companies. We provide sort of training, consulting, and mentoring around that. We've been a thought leader in the Open Group, which is a worldwide organization for standard setting as a gold member. And we've been involved in actually defining and developing some of the best practices and methodologies around the Open Group's architectural framework called TOGAF for the last 7+ years as well. And we've implemented projects in various different industries around enterprise architecture, healthcare services, public sector, financial services, supply chain. Just to give you a background, we've done a lot of work in the health area. The Australian government, New South Wales, which is a state in Australia, New South Wales Government Health, World Health Organization, as well as we see lots of logos of companies all the way from service providers like IBM, Deloitte, all the way to end users like of Costco and Johnson & Johnson. So, we're a global company, a very niche boutique global company focused on this emerging technology and the architecture implications of it. Let me just, move on and talk about why, what has changed that is driving this innovation and transformation. Big data is at the heart of a lot of things that's happening. Just to give you a scale of the data that's being generated, I've just got some statistics on the left-hand side, and they're already a year out of date. But just to give you a sense, just in the last 30 seconds that I've been speaking, there's probably more than 100,000 tweets that have been emitted. Probably more than 1 million status updates, lots of instant messages, millions of Google searches in the last few minutes, and terabytes of new data that's created. And really, the catalyst for all of this has been the internet adoption across billions of new consumers in the last few years in the emerging countries, technology company, as well as the adoption of smartphones and people using smartphones. In most countries, you're finding smartphones becoming more and more as the norm as opposed to the exception. And there's a whole trend around this Internet of Things, which is previously was just laptops and desktops and phones were connected to the internet, and now it's a whole laundry list from cameras to printers to sensors of all different capacities. And just to give you an idea, in the health side, there's been some of the major vendors are starting to get into how do we e-health enable the population with their smartphones. And you may have seen Apple have just recently released an app and a toolkit called Health and Health Kit. And what that aiming to do is really to capture some of the basic vital signs, I guess you could put it, of heart rate, the movement, and even ability to plug in, collect things like blood sugar, and people can type in their cholesterol levels, and with the API, I'm sure they're trying to get innovation around using the smartphone as a way of your hub in terms of capturing, things like blood pressure, etc. And so we've seen this explosion in capturing the data, as well as this sea of sensors out there. And I won't go into all the stats, but needless to say, in 5-7 years' time, we're going to see billions of devices connected to the internet. So no big data presentation can escape me not talking about the V's, but let me talk about it in context of what we're talking in the health sector. So big data is all, I guess big is all relative in the data context. But I think in healthcare we are seeing a tremendous increase in the volume of data, the velocity of data, variety and veracity. Typically, these are the dimensions when they talk about big data across the 4 V's. And to give you an idea in terms of what we're talking about, we're seeing the volume of data is just since everything's being digitized is growth and exponential levels, all the way from what I said is information coming through from smartphones, but clinical trials, research, clickstream analysis. In terms of velocity, previously, you were limited by the data that was handwritten and maybe was typed in, but now you've got more and more digitization, as well as you've got real-time things coming off the internet, like the smartphones I talked to you about. On top of that, we've got a great variety of information, and obviously, but the quality of the information varies significantly. So, there's been a lot of research done into the sort of different growing pools of data that is available to the healthcare industry, and really there's four different kinds, and the innovation and the opportunities really lie at the intersection of those 4 key data pools. So on the bottom right, you'll probably see that you've got patient behavior and sentiment analysis, sentiment data. So this is the retail example I was talking to you about, is captured through various different whether it's sensors or data entry points. On the right, top right, we've got the more traditional clinical data that you see, electronic medical records. You've got your scans, the biometrics, blood tests, radiology, and it's become a lot easier and cost-effective to store that in a central manner. The cost of storage has gone down tremendously in the last 5 years, so cost of storage has become a lot more effective. On the top left has been the traditional information around captured by the administration in terms of the cost of the care and estimates and the outcomes. And what we're seeing is that people now want to know, by looking at clinical data as well as the claims data, people are able to talk about, are trying to figure out, moving away from a pay-per-use model for healthcare, more towards, which is like going to a doctor, paying a flat fee, going to a specialist, paying a flat fee. They're talking about, well, let's figure out what is acceptable cost for outcomes. So let's talk about outcomes for clinical conditions as opposed to different cost elements, and reward institutions that are able to deliver the lowest cost outcome, based on different situations. And of course, you've got the pharmaceutical and R&D data, which is now being, in an open beta, initiatives promoted by the government, is tying up between clinical data and pharmaceutical data to give better research outcomes. If you talk about the increase in data volumes and velocities and the interconnected, big data is really at the foundation of a lot of different evolution of healthcare. So, today's healthcare in most countries is pretty standalone. Best of breed solutions, data islands. Some countries and institutions embarking on the whole electronic health records, having data capture real-time alerts and messages, but we've still got a long way to go in terms of the integrated healthcare management that you see on this continuum. And I won't go into a lot of detail in terms of the roadmap. For most countries, and this is probably a 5–10 year journey, but gathering the data and analyzing it is at the core of a lot of this journey. One of the other things that we see in driving the need for driving big data is this shift in mindset, which is really talking about empowering the individual, and the individual taking greater interest and directing healthcare professionals in terms of health outcomes. So, and I think this was probably started 10–15 years ago, when a lot of this information was available, at least medical information or symptoms or how you could diagnose were available on internet, and good old Dr. Google became the first point of call for a lot of people with any ailment. And so we've seen this empowerment go on to the next level, where instead of the patient or consumer being the passive consumer and basically just following what the doctors have prescribed them or suggested, they're really becoming a lot more empowered and becoming interested in their own health, long-term health, and they're almost demanding that they be able to store their data in a central place and to be able to access it as well. And I think that's a good thing, because for too long, consumers weren't involved, in a proactive way. So what we're seeing in some of the applications of big data is the combination of existing data sources like clinical data, treatment protocols, pharmaceutical data, combining with some of the engagements or systems of engagement data, which are like digital breadcrumbs that are left behind in the interaction. So this is where I'm talking about social media data, unstructured clinical notes, call center audio, and how do you bring that into the data pool. And that's really where we see a lot of innovative applications. And what I want to talk to you about is talk to you about some of the applications that we're starting to see in terms of this big data being rolled out. But before I do that, I just want to talk to you about, a study, a very groundbreaking study has been done by McKinsey that talks about high-level benefits, specifically around the U.S. healthcare system, in terms of how big data can transform as well as save tremendous amounts of costs in the healthcare system. For some of you that are aware, the U.S. is probably the highest spender in terms of total healthcare. It's in the trillions of dollars. But basically, 20% of the GDP of the U.S. is spent on healthcare. In all aspects of healthcare. And with the aging population, that's growing at an alarming rate. And they looked at across various different dimensions in terms of how big data can be used. First of all, to proactively get people to look after themselves and be proactive in their own health, the right living, making sure that in terms of taking care of patients, is to make sure that they're directed in the right care facility, as well as to the right provider from a cost envelope. And really, and the other dimension to look at is making sure that from an evidence-based and cost of treatment point of view, there's a lot of transparency in terms of outcome-based pricing. And as well as driving innovation across the whole R&D and drug discovery. They were able to quantify the savings in terms of using some of the big data technologies across those 5 areas that I mentioned, and the numbers are mind-blowing. They predicted, this is McKinsey's Global Institute looking at the U.S. healthcare costs, that by extrapolating the savings from some initial pilots that have been going on in the U.S., they estimate that within 5 to 7 years, they may be able to potentially reduce $300 to $450 billion worth of healthcare costs. That would equate to about 10 to 12% of total healthcare costs. And but look, these numbers are absolutely staggering. And if you are able to, extrapolate on a global basis, you may be approaching, close to $1 trillion mark. So this is obviously an area that's got a lot of interest. And if you look around in terms of some of the opportunities, right living. So, making sure that you prevent the disease. Make sure that the adherence programs are there. In terms of right providers, we want to make sure that you're reducing the emergency emergency room admittance and the readmit rates. Looking at it from the right value, not only making sure that for severe conditions, you're going to the right health providers that have the demonstrated lowest cost return in terms of treating a particular ailment, using transparency available data, but also to reduce fraud in the system. And fraud is a big issue whenever in sort of managed care environments. So a lot of opportunity in the long term where data can be used across the whole value chain. Let me dive a little bit more into some specific, some use cases of big data that companies have talked about, and I'll also talk about a case study in terms of how big data is being used in some specific situations. So let me talk about a couple of, in this example, what I'll dive through is looking at some different ways of using the data that's been collected. The first opportunity is looking at keyword analysis, basically text mining. As more and more of the information that's being gathered by doctors, nurses, reports are being digitized. Just simply collating that and applying text analytics at scale, you have the ability to spot patterns and anomalies. In this example, an example where you can start filtering out, the process of filtering out some of the noise factors and creating, word stemmings in terms of similar words that may be typed in that have a very similar meaning, and then doing a frequency analysis as well as theme analysis, and in real time you're able to spot patterns and issues that may be of interest to various different departments, within a hospital or different care providers. And so here, there's various different examples of people typing in, sleep, insomnia, sleeplessness, and that's being triggered. And so you don't need to have a human monitoring all these real-time signals, but you could have, computer systems and analytic systems that can bring this to the attention and alert a medical professional when it gets above a certain threshold. Another example could be in a hospital, for example, a large hospital. We've got potentially hundreds, if not thousands, of patients, specialists that are and doctors that are wandering the corridors of the hospital, and potentially nurses. And with the current technology, you can have either RFID or soon a lot of the smartphones are going to be having these emitters, the NFC emitters, so you can know the location of everyone, and as well as the condition. So within a large hospital really where people are. So whenever there's an issue that needs taking immediate response, you can even plan and almost like a control center, know where the closest specialists are, the nurses are, in real time in a map on around the hospital. So this is an idea of a constant stream of information that can be analyzed as well as then actioned. This example of the telemedicine analytics, really this is going to this is really becoming almost mainstream, especially with the health applications on smartphones. You're able to capture a lot of basic data automatically, and using the internet, transmit that to some storage and monitoring facility. But if you've got some more sophisticated sensors, in this case purpose-built platforms that can do your temperature, heart rate, blood pressure, perhaps even take ECG, and over the internet, be able to in real time communicate this information. Not only can you have face-to-face consultations, but if it's automated, you can set up using simple analytics and complex event processing systems, automatic monitoring as well as automatic response, based on this stream of information. Another example could be once you've got this information being digitized and entered into some clinical repositories. Even if you're in very busy hospital scenarios where the same patient may be seen by multiple people over multiple weeks, you not only do you rely on the doctors and the specialists to help find patterns. You can have computer systems with algorithms, data mining type algorithms, who can look for keywords and the frequency and the occurrence of those keywords. In this case, you've got episodes of anxiety and anger, and at the next encounter, you've got restlessness and thirsty, and a few days later, insomnia. And a trained clinician will probably very easily figure out that you've got something, a heart issue, but with computer algorithms, in the background, it could probably alert you, the health professional, of this even earlier. So it's all about, I guess, gathering the data and then analyzing in real time using computer models. I won't go into this. So this really brings up the whole area of big data. As I say many times, no one wants big data. They want the insights and predictions that come from big data. And in terms of what we're finding is some other use cases for this sort of predictive analysis is looking at the patient experiences across a whole continuum of care, by examining referral patterns across providers. Companies have even found that they can detect fraud by looking at referral patterns of individuals. Things like tracking infections within hospitals by automated sensors, and really looking at a lot of other diagnosis opportunities. But in terms of doing this, look, there is a lot of expertise, a lot of data science behind the scenes, a combination of medical domain knowledge combined with deep IT computer science knowledge and business analytics knowledge required to do this. So, let's not kid ourselves, this is not easy, but the payoffs are tremendous. Again, looking at the evolution in terms of the analytics space, the healthcare providers need to develop this range of healthcare analytics to really maximize the business impact. So, if you have a look at the most basic stuff, in the diagram, which is reporting what has happened, and this could be as simple as looking at the misuse of drugs, identification of obsolete drug usage, to real-time monitoring in some of the telemedicine examples I talked about, which is like what is happening right now, through lots of different sensors on the patients, whether they be in a hospital or remotely. Then having a look at, well, why did it happen, and the whole evaluation side, which is looking at what is the efficiency of the efficacy of the drugs, looking at all the way from benchmarking hospital productivity to identification of drug interactions, and then there's the element of predicting and simulating what will happen in the future, and this is where a lot of the opportunities are. But this journey is not an overnight journey. Could take organizations and countries many years to to go up this value chain. Let me give you an example of a case study in the US where they're able to combine a lot of this thinking into a real life scenario that's already demonstrating some results. And the case study I want to share with you is from the Department of Veterans Affairs in the US and a project called Durkheim project. So for those of you who are not familiar, the Veterans Affairs really looks after the care of returned war veterans, all the way from, I guess, World War II, to, in their case, Vietnam War, to, people returning from Afghanistan, Iraq, all those major fields of theatre. So, it's a separate department. They've got their own medical hospitals, massive budget. I don't have the numbers, but it's in the hundreds of billions of dollars. Tens of billions. I don't think it's hundreds of billions, but pretty significant. So one very sad issue that they face is that the U.S. veterans, because of their experiences in combat theaters, are not able to cope when they come back home, and they're committing suicide at an alarming rate. First of all, I'm sorry to bring out such a morbid topic, in this thing. So, but let me. I've got a question here. I'll answer a bit later, if you don't mind, towards the tail end here. And U.S. veterans. So in this, in this example here, the statistics are quite disturbing, as I said. Looking at the suicide rates, they're double what's happening in the U.S. general population. 21% of all suicides in the U.S. are veterans. But a lot of them actually do call up in advance to have a look at, to talk about the issues in the Veterans Crisis Line. So a dedicated group got together to say, well, how can we use big data analytics to stop and prevent, if we can, this fairly disturbing trend. So in terms of they put together a team of psychiatrists, U.S. veterans administrators, people with a computer science background in terms of artificial intelligence, machine learning, as well as they were able to develop linguistic prediction models to estimate risk of suicide. So that was their goal. Is, well, how do we predict when a suicide or veteran is at risk of committing suicide? So they actually created some models where they went through and said, well, let's look at the people that committed suicide, and then figure out all the background records and what they've had any, what they've said to the clinicians, as well as in social media, perhaps. To try to figure out, how do we predict this or build a model around it. And so they were able to, sorry, if I go back, they're able to generate data sets of, single words and multi-word phrases that was a model, and use machine learning algorithms to create, to go through the data to create this model. So in the phase 2 of this project, what they did is, well, let's see if we can, they tried to apply this model in real time. And they went through and they built a database of 100,000 U.S. veterans that they thought that may be at a small chance of being at risk. And then went through a program of contacting a percentage of them and enlisting them in a real-time monitoring of their social media feeds, so that they've got a sense of what people are, these veterans at risk are saying on social media, and set that up for clinicians, caseworkers to monitor that and create a dashboard in terms of when they're at risk. And I just want to show you this in terms of, what they were able to create as part of this project. They were able to, first of all, have these at-risk veterans sign up to this program where they, their social media on Facebook and Twitter, as well as Google Plus, would be monitored, as well as they've got the records of, past history with Veterans Affairs. And so, in this example, you've got a particular, veteran called Steve Jones. He's posted something on Facebook. That doesn't mean that, clinician at Veterans Affairs is reading this in real time, but it goes into their database, at-risk database, and the clinician or the caseworker in this case, who would be some sort of psychiatrist or psychologist, would be assigned maybe X amount of patients to monitor, and based on the models run in the background, it would highlight that the Steve Jones has said something that probably means that the risk of suicide may be high. So they can drill down into Steve Jones, have a look at what is the at-risk factor, probability, the keywords that have been triggered, and you can even, in this case, the clinician can drill down into, well, what is it specifically that, in this case on the right-hand side, what is Steve Jones said on Facebook, what has he said on Twitter that may be triggering the model, and as well as have a look at the medical history of Steve Jones. So it really provides an integrated view, I would say what we call 720-degree view of the client, of the patient, in terms of their at-risk behavior. So in terms of the technology, there's a lot of innovation going in terms of storing the information at scale, searching for information, and obviously, having statistics, having some, statistics capability and machine learning and data science capabilities required to build the models, as well as interpret and refine the models. Let me just skip a few slides. I know we're running a few minutes behind schedule. So really, what if I was to summarize that, it really talks about big data analytics used in a specific problem area. In this case, it was U.S. veterans committing suicide. The sources of data was really the past clinical data that was stored in the veterans database. But the innovation here was adding social media feeds of the at-risk patients, obviously with all the checks and balances in place, as well as the other innovations could be, was also, they haven't looked at this yet, but could be looking at the call center, voice analytics as another data source. And really the outcome is, they're seeing the reduction and proactive, efforts in reducing the veterans committing suicide. And really they were able to say that the data model that they built, was, and with the keywords that they come up with, is statistically significant to at least 65%. And, that work will continue in terms of improving that accuracy. So let me just, jump back in terms of, well, what does this all mean? There's a lot of transformation that needs to happen, for these sort of, data collection as well as analytics capability. And really what you're talking about is this integration across the existing legacy systems and the new, sources of data, whether it be social or mobile. And really this new style of IT healthcare is around big data, cloud, big data, security, and mobility. And really what we're looking at is this need to think about, the enterprise architecture in this whole healthcare transformation. And, this is really our focus is how do countries and communities, as well as, healthcare systems, can create a blueprint using this new paradigm for healthcare transformation. Have not only the end citizens have access to their own data, but as well as the clinicians at the point of care have this whole 720-degree view of the healthcare data. This is not just what's been captured by health professionals, but also what's relevant in social media at point of care. And I guess my example showed a good example of that. And from an enterprise architecture point of view, it's all about looking at the whole business layer. How do you transform from the traditional model to a collaborative and outcome-driven data model, a data-driven model. And looking at the data layer, traditionally we've only been storing structured data, but big data is all about a whole stream of unstructured data, the real-time data from sensors, and the whole complex event processing that goes around in terms of capturing this data. And obviously there's a lot of, at the application layer, a lot of innovation going on. But fundamentally at the technology layer as well, you're moving away from on-premises to cloud-based solutions, to store these massive amounts of information. You've got non-relational databases, with Hadoop, NoSQL, in-memory databases, tremendous innovation going on to cost-effectively store and analyze things in real time. So, look, lots of opportunity, as I said, to summarize. As I said, McKinsey's Institute survey just in the US, they said up to 10–12% of healthcare costs, totaling anywhere between $300 to $400 billion just in the US. Pretty significant opportunities here. It almost needs to start from the enterprise architecture downwards in terms of how do you take advantage of this. Just in terms of us, we're very focused in the healthcare area, and focused on the enterprise architecture implications of this transformation. We've been involved, I guess, in the open group leadership in the standardization issue for enterprise architecture and what we call Platform 3.0, which is the integration of the social media, big data, cloud, and the platforms around that. Because from a healthcare point of view, we have engaged with quite a few of you in terms of training around architecture frameworks, around TOGAF and Archimate. We've done work with customers like Johnson & Johnson and other sort of Fortune 100 customers, as well as sort of agencies around Asia. So we've got a good sense that this is not, while there's a lot of opportunity, it's not an easy journey. So look, that's all the remarks I wanted to make in terms of big data analytics and the opportunities. I know there's already been some questions that I've got. So why don't please do go ahead and ask some questions. Let me start off by talking about answering some of the questions that have come up already. Look, the first question is it true that predictive analytics is at the core of clinical decision support systems? Look, I think the ability to predict I mean, there's two elements here. One is how to easily get that 720-degree view of the client or the patient, which is all the existing clinical records as well as the external, relevant information. That, I think, is step one, and that itself is not to be underestimated. But really, I think this ability to build predictive models that can help understand, what the data is saying, and really you do need deep domain knowledge to be able to build the models, as well as marry that up with people who've come from a more data science background, as well as maybe deep computer science background, who can build, that can automate the models in terms of, data gathering and as well as coming up with sort of predictions through the model. So I would say yes. I mean, predictive analytics is very important, domain and skill that needs to be nurtured. Look, the second question is, what are your thoughts on big data generated from social media, like tweet mining? Would this be useful in healthcare? Look, I think there is. I think it's a double-edged sword. As I said, in any 1 minute, the stats are there's 200,000 tweets available, being generated at the moment. So there's a lot of the signal-to-noise ratio is very low. So you need to be very, very good at shifting through some of this data, try to find the nuggets. And so in the example I gave you, which was the Durkheim project, is probably a good example of where you've taken a very, very targeted group of people that are already at risk, and then monitoring the social media related to them to give you greater fidelity in terms of spotting trends. But in general, sort of tweet mining, I mean, looking at across a vast, I think there's been people that have tried to say, let's look at tweets around the country and come up with a happiness index, or mood of the country or mood of the population. So there's that sort of issues going on, but I'm not sure how useful that is, in specific healthcare outcomes. It's probably good from interest point of view.
Right, Raj, we have some questions also here from year one. The question is, on a clinical dashboard, would it be in compliance with HIPAA Privacy Act?
Sorry, could you repeat the question?
Okay, the question is, on the clinical dashboard, would it be in compliance with the HIPAA Privacy Act or HIPAA Privacy Act?
Yeah, look, that was, in this example, that was a key consideration when they designed this system, this pilot. The actual medical database in this pilot was behind a medical grade firewall at a School of Medicine, and it was really designed by medical professionals according to the HIPAA privacy rules. So there was a lot of thought, and obviously, they looked at this very carefully, being a sort of test bed, is looking at first of all getting permission from the patient to actually monitor their details, and secondly, in terms of storing it and the security and privacy around storing the data, and thirdly is access by only a very few select clinicians who were given the task of monitoring this in real time. So in this case, they did follow the HIPAA privacy rules. And but yeah, a lot of thought has got to be gone into these systems.
All right, I hope that addressed the question of Year 1 Bruce Lee. Another question from Rajiv Joshi. How do you detect outbreak of infection in a hospital or in a community?
Look, very good question. I guess with any of these things, you need to look at making sure there's enough, data points and knowing the sort of time frame of those data points. And then it's not easy. And I'll give you an example of, even people like Google haven't got this wrong. Look, it's a matter of understanding, gathering the data and looking at the statistical correlation in terms of geography as well as time frame, in terms of where this occurred. I'm not a medical professional myself, so I couldn't give you a definitive answer on that. But let me give an example of where Google thought they had a great way of trying to figure out where there was some infection or flu outbreak, and they used a data point of people searching for things related to flu symptoms and flu medicines, and so they built some models, and they sort of quite proudly were talking about how they've been able to predict flu patterns around the world. And after a couple of years after predicting when they look back at the actual data in terms of what happened, they sort of severely overestimated the actual incidence of this occurring. So look, it's not an easy science, and just because you've got lots of data and lots of real-time data doesn't mean the models that you build are any better. So the crux of the issue is making sure you can build right models and statistical. There's a big difference between causation and causality. So you do need some good statisticians to be able to figure out and build these models. And obviously the domain, people with the right domain background. And this is where the need for data scientists that have a medical background is becoming even more urgent, because you need to marry all these technology advances with the real life application of it. So I hope I was able to answer part of that question.
Right, there are really a lot of ways to use big data, and if we could maximize, if we could mechanize this, it will really be useful on healthcare. I have a personal question with regard to the Durkheim project that you have shared. This kind of approach requires a personal consent to them, because you're basically tracking their information, which they basically share publicly. So do you really ask for consent, patient consent, or consent to these people whom are being monitored?
Yeah, absolutely. Obviously, if they publish things on Facebook and Twitter, it is being broadcasted at least to their family, their friends, or whoever they've got connections with. But specifically, there is a very rigorous process where either they need to opt in to have their social media posts monitored by the Durkheim project. So privacy is obviously a big issue, in all parts of the world. So they do need to opt in for this, either themselves or if they're incapacitated, perhaps, or maybe a family member needs to opt in for this program.
All right. So thank you on that. I think we have more time for this last question from AeHIN. Should there be some consideration on the probability or statistical uncertainty acceptance of which you have shared a while ago on the FTA? Okay, let me repeat that. Okay, let me first read the former question that he or she has sent. Can you elaborate on the roles or responses by the government institutions on the big data challenges?
Well, I think the government's got a very, very important role to play in each country to to provide leadership in this space. It can't be left up to individual healthcare systems and individuals to drive this transformation. Obviously, there's legislative issues that need to be looked at. The government can encourage data sharing, because none of this is possible without an environment of collaborative data sharing between hospital systems, primary care systems, as well as patients and end users, and even pharmaceutical companies. So look, the government is at the core here, a lot more than any other industry I can think of in terms of driving transformation. That's a short answer to a very, very long potential answer.
All right. I think that will be the last. Okay, we have two more questions. One more question. I hope you could still accommodate this from Mr. Ramon Duremdes. Can you provide examples of consumer-oriented and consumer paid big data applications?
Look, in terms of, I guess we're just at the beginning of this revolution. I would say, what we saw with, what we saw at the beginning with, with this Apple and healthcare apps is just the beginning of this revolution where people are starting to, become, automatic data gatherers. So I can see a service where you can say, look, I'm uploading all this data about myself. People may be willing to pay for some automated monitoring of their health data. So instead of having to reactively go to a general practitioner or hospital, people may be starting to be open to pay for automated systems to at least do some first level type alert if I'm at risk. But it is a bit early for consumer based, I think, big data applications at the moment.
Right. And thank you for answering that question. I hope maybe we could see some stories on how we could arrive on those applications later on. There's a question from Pakistan. Can you tell some big data management tools maybe that are existing on the internet?
Well, thank you for the question. I guess it's a very, very broad question. Big data management tools. I mean, the first thing is you need to, the big issue is to consolidate it all. In terms of storing the data, there's some open source technology to actually store the data, and and one example could be this platform called Hadoop, which was in fact used in this Durkheim project. Then in terms of the analysis, there's some open source, tools called R. That's a capital R. That's statistical, tools to help build some models. In terms of management, I guess it's a very, very broad area. But look, you need to, at the end of the day, you need to store it, consolidate it. You need to analyze it, and then in terms of managing it, there's lots of open source type complex event processing systems. When you got a steady stream of information, how do you do if then else, try to find patterns and take action based on that. So I'm not aware of any names, any sort of specific tools off the top of my head in terms of complex event processing, but you can definitely find them. They're definitely there. So I hope I know it's a broad question, probably haven't done it justice.
All right, I think we're about to end. As you said, thank you and okay on that. We're about to end, but before we end, I hope you could give us a very short but sweet key message for this afternoon. What would be the major takeaway for this session on big data, applications and opportunities in healthcare for a summary?
Do you want me just speak for a couple of minutes? Is that what you want me to do?
Yes. Go ahead.
Big data in healthcare is really providing a foundation for, I think, an evolution of healthcare that hasn't been seen, I think, ever. The digitization of the records, consolidation of a wide variety of data assets is creating an opportunity which I think is quite unique. Studies have shown that it could shave as much as 10 to 12% of healthcare costs, and just in the US that could be over $300 billion. The opportunities are tremendous. The complexity is great. It's an area that's going to grow and evolve and is going to be changing, and it's probably a wonderful area to focus on for people that are interested, in all aspects of innovation and improving health outcomes. Should be an exciting space to watch in the coming years.
Right, thank you so much. That is Mr. Raj Dalal of CC&C Solutions. Raj, do you have a video with you? Could we have a short virtual photo taking session for our AeHIN 101 publicity?
Okay. Well, what do I need to do?
You just have to show your video.
Okay, let me just sorry, how do I do that? Yeah, just press this button perhaps.
Should you click show your video? You should be able to show yourself. So
okay, is that
all right, so that's it. Let's just have a screenshot. 1, 2, 3.
got it?